But here's what I know for sure. We live in a great country, an amazing country, a country of bounty and plenty. And no one in this great country of America, in my opinion, should go without health care. I believe, to the very fiber of my being, that health care should be a right and not a privilege. And saying that, that means we as Americans have to figure this out, because we pay for each other's health care one way or another. You either give people personal responsibility for their own health by being able to give them affordable health care coverage so that they can be covered for themselves and their families, or people will go to the emergency rooms and end-of-life care who don't have health care insurance, and we all end up paying for it. So I think it's really important that we figure out a way that we make healthcare accessible and affordable for all Americans, and we do it on the front end. We do it on the front end so people can have preventive care, so that they can help care for themselves and their children on the front end, so that we're not always waiting until catastrophic events happen in our lives and we need healthcare services. So that was one of the premises for the Affordable Care Act, and I think that is something that the Affordable Care Act did accomplish. It set standards for sort of essential services and benefits that I think are important. It also really helped not only those who are on the exchange, but all of us by making sure that insurance companies can no longer discriminate for pre-existing conditions. That helped all of us, whether you got your health care through your employer or you bought your health care on your exchange. That was a benefit that all Americans have now come to depend on. The second thing that I think is important for me, when I look at sort of evaluating the repeal and replace bill, I looked at three criteria. My first criteria was cost. And the repeal and replace bill would cost more. My second criteria was coverage. It would cover less. 24 million Americans would be kicked off of health care. Let me repeat that. 24 million Americans would have less health care in the repeal and replace bill. And the third criteria is how much benefit or protections would you have? And you would have less because it allows states like Alabama and any state to waive pre-existing conditions, to waive essential benefits. So let me just say, it costs more, you get less, and less people are covered. So I voted no. Actually, I voted hell no.